My name's Julie Bliss and I'm a senior lecturer in the Florence Nightingale Faculty of Nursing, Midwifery and Palliative Care. Just recently the Cicely Saunders Institute of Palliative Care joined with us in nursing and midwifery, and clearly that's a really good match. So welcome to King's. King's College London has got several campuses. The Faculty of Nursing and Midwifery, we're based at Waterloo. We do a fair bit of teaching there, but we also have the Clinical Skills Centre here at Guy's that we're involved in and where we do some teaching. This is Professor Ian Norman. Ian's our head of faculty, and were he here, he would also be welcoming you to King's and to the possibility of you coming to study nursing with us. Ian's one of the editors of the International Journal of Nursing Studies, which is one of the highest impact journals for nursing across the world. So what can I tell you about the college? King's College London is a Russell Group university. It's a university that's been around for a long time, I think since 1829, and we offer a range of provision within the faculty. So we run pre-registration nursing programs, also pre-registration midwifery, and then we have courses for qualified nurses and midwives and other healthcare professionals. So for example, prescribing, we run a number of master's programs and students have an opportunity to come here and study for their doctorate. The other thing about King's College London is it's part of the King's Health Partners. It's an academic science centre. So King's College London, King's College Hospital, Guy's and St Thomas's NHS Foundation Trust and the South London and Maudsley Mental Health Trust all work together as part of King's Health Partners. And one of the drivers about the Health Partners is the idea of being able to get the research from bench to bedside. So things that are being researched in the college about making sure that it gets into clinical practice as soon as possible, and vice versa. What are the challenges and questions that are coming out of clinical practice that might need to be addressed with research? In England, there are 6 academic health sciences centres. So in a way, part of the Golden Triangle, so London, Cambridge and Oxford. So what about the nursing programmes that we offer? With the Nursing and Midwifery Council for registration, there are 4 fields of nursing, one of which we don't offer here. So if you're interested in learning disabilities, that's not something that we offer here in the faculty at King's. But we do offer programmes that lead to registration as an adult nurse, as a children's nurse, or as a mental health nurse. What you'll see looking at the slides is that we offer them as an undergraduate programme, the BSc, or if any of you already got a first degree, we offer it as a postgraduate diploma. So that's a 2-year programme for people who've already got a first degree, and that's at level 7. To be honest, it doesn't matter which level you do it at, you will become a registered nurse, you will meet the Nursing and Midwifery Council standards for registration as a nurse in whichever field, whether you do it at undergraduate or postgraduate. The other thing that's the same across both of the programmes, and indeed will be wherever you go to study nursing, is that the programmes have a split of 50% theory and 50% practice. And again, that's part of the Nursing and Midwifery Council standards for pre-registration nursing. That's really important because actually what you want to do at the end of your programme is to be safe and competent nurses, so able to work clinically. What we're wanting you to do is to get the knowledge and skills within your college time that you can then take into clinical practice and apply and be the nurses of the future. So as you can imagine, if it's a full-time programme giving you a professional and an academic award, it's quite busy. And so there's a lot of support available within the college and indeed within the faculty. So if you come and study at King's on the first week or 2 weeks, you'll be allocated a personal tutor, and that will be a member of academic staff who will be available to support you throughout the duration of your programme. So at the moment, Jacqueline and I are busy doing references for our degree students who started in 2015, who are going out there into the world with their first jobs on registration. There'll be a cohort lead, so if you start in September 2018 to do mental health, one of the mental health staff will follow your cohort throughout the 3 years of your programme or the 2 years. And the other thing is when you go out into clinical practice, as well as being supported by the clinical staff, and the mentors out there in the real world, as it were, you'll also have somebody who links with the area that you're going to. So if you've got any questions or queries, you can ask them in order to take that forward. Why come to King's? I suppose one of the things that you need to think about is, okay, I want to do nursing. Decide which field of nursing you then want to do. One of the questions then I think you have to decide the answer to is, do I want to study in London or do I want to be outside London? Now, we're biased, so we'll fess that up now, but if you want to come to London to do nursing, then come to King's, because actually it's got lots on offer. One of the things that's really great about King's is that we have a breadth of health schools and health professionals working here in the college. So as well as nursing and midwifery, we have medical students, dental students, physiotherapy students, pharmacy, dietetics, a whole range. And there are opportunities for interprofessional education throughout the programme, because actually you're going to be working with most of those professionals when you start as a qualified nurse. The programme's very much about putting the patient, the individual and their family at the centre of care and looking at how we take those things forward. And what we're looking to do as a faculty is to develop you as you come on your programme to do your nursing, not only to be a really safe and competent practitioner who's able to use the best evidence, but also to be a partner in care. And that's not just about that partnership working with the other health professionals that I've already talked about, and perhaps social care or education, but also with the individual and their families and their friends and potentially the community. In relation to the structure of the programmes, they'll all give you the registration as a nurse and they'll have slightly different formation, module structure, etc. And we'll come and look at that later on in the presentation. For the undergraduate students currently, there's a choice to choose a module in the second year. So some students choose to do child and adolescent mental health, there's contemporary primary health care, there's a global health option, there's plenty of variety there. So I've talked a little bit about the interprofessional education. We work as patient educators, so on the mental health programme, there's an opportunity to do a physical health module where people who have mental health difficulties but also physical health needs will work with them to do a joint assessment and plan their care. And there's also an opportunity to do the electives, which Jackie will talk about in a moment. The other thing to say is that actually the practice learning is not all in the hospital setting. So particularly for mental health, it'll be probably 50-50 inpatient care and out of hospital care. One of our colleagues did some work with some school children asking, what is it you want out of a children's nurse? What would make a good children's nurse? And these are some of the pictures that they drew of the different areas where you might get your health care. So quite a lot of it is not in the hospital.
So we hope that you will base your training in London, but the world is becoming a much more globalised place. And if you're in London, you will be exposed to many multicultural factors. But we also are very hot on international opportunities. We have the King's Strategic Guidelines in 2029, by which we're aiming to be an internationalised university at the heart of the world. And part of that, in terms of how it impacts upon the Faculty of Nursing, Midwifery and Palliative Care, is we are promoting opportunities for you to spend time abroad during your training, or to have an experience which is different within a specialised area nationally. In addition, you might choose to stay here and do a research elective. We have many experienced and well-renowned researchers in the faculty, and in that case you would work with them looking at skills that are pertinent to research. So the NMC, the Nursing and Midwifery Council, says that you can do 150 hours in an unassessed practice area. And different universities interpret that in different ways, but at King's, and we are the only Russell Group university in London that offers this, we encourage you to do an elective of some sort. So a 4-week placement, either internationally, whereby you can do it through a company or by going somewhere that you might already have links with, to a charitable setting or to a hospital, or you may do a national elective, as I've said, an area where you're really interested in, but you won't get an opportunity, such as maybe going home to mum for a month and perhaps going out with the local ambulance service or with the district nurse or something like that, a specialist area. Or, as I say, staying put and perhaps considering doing a research elective. And in addition to the electives, we are developing a series of exchanges, 4-week exchanges, and that has the added advantage that you get to know your counterparts, and you would buddy your counterparts when they come to King's, and when you go over abroad, they will in turn buddy you and introduce you to other nursing students and to the area as well. So at the moment we have 2 such exchanges. One is with Japan, so 4 weeks to Japan, open for 2 students a year by a competitive process. That one actually is all expenses paid, so it's quite popular, as you might imagine. And then we've just started now this one with the University of Sydney. It's quite difficult, even if you're a native Australian, to get clinical placements in Australia. We have a professor who previously worked at our faculty and now is at Sydney, and there is an opportunity to spend 4 weeks in Sydney for up to 4 students. At the moment it's adult only, but we are working on that. Additionally, Julie's already mentioned the global health module, but we have a faculty global health forum, so if you are interested in NGOs and global health, once a term we have speakers, either from outside or sometimes from within the faculty, and sometimes students that are involved in various overseas charities, which is open to everybody, faculty and students alike. And because we are part of King's Health Partners, we are also involved within the faculty with health partnerships. And there are 3 of those. One is in Sierra Leone, and you may have heard about the work that King's were doing in Sierra Leone during the Ebola outbreak. And there's also one with the Congo is the latest one, and a long-standing one with Somaliland.
So I think that gives you a flavour of some of the opportunities that are available. One of the things that is also really important to us is that we as a faculty work towards the NHS Values. So this is taken from the NHS Constitution, but actually I think this also mirrors the philosophy of the faculty. So as academic staff and professional services, we're working very much in partnership with our students and with our clinical partners. And these are the things that if you apply to King's and we invite you to come to a selection event, this is what we'll be looking for. We can teach you to take a blood pressure, we can teach you to weigh a child, but actually some of these things about respect and dignity are really about you as individuals, and that's why we're looking at that when we're undertaking our values-based recruitment. We've talked about the fact that we've become the Faculty of Nursing, Midwifery and Palliative Care. It was the centenary of Cicely Saunders. She was a nurse who had some experience in social work and went on to become a doctor, and thought actually we need to be managing end-of-life care differently. So she was very instrumental in starting a lot of the hospice movement and that kind of thing. But also we are a direct descendants of Florence Nightingale's first school of nursing at St Thomas's. There she is with her nurses. Can I just assure you that your uniform has changed? So moving and handling is not restricted by those long gowns. But actually that's really important, being part of the college's history. There are 5 campuses. I talked earlier about the fact that we're based mainly at Waterloo, so the academic staff are at Waterloo. It's also the same campus that the principal of the college is based at. We also have this campus here at Guy's. There's a campus over at the Strand where some teaching might take place. There are some teaching facilities over at St Thomas's, and we also have some down at Denmark Hill on the King's College Hospital site, which also links with IOPPN, so one of the hospitals within South London and Maudsley. So you can see that actually we're right in the middle of it, great opportunity, and as much as we want you to work hard, if you come to King's you will be able to have some downtime as well. So there's lots to see and to do. The clinical practice, so I talked about the fact that 50% of the programme is in clinical practice. We work with a number of partners across London, so this gives you a kind of a taste of where we're working. The way that it works is that if you come to King's to study as a nurse, when you first start, we'll look at where your term time address is, and then we'll think about what would be the best arrangement by a way of travel, etc. for where you're going to be based. And you would likely to be with one provider for the bulk of your placements, and we describe that as the host trust. So you might be at University College Hospital London, which is up near Euston, or you might be down at St George's in Tooting. So a range. Central London Community Health provide community services only, and they do host a small number of students. So if anybody's interested particularly in community nursing, if you're hosted by the trust there, then most of your placements will be out of the hospital and some in the hospital, which is really exciting. I am not going to read this extensive list, but I just want to give you a flavour of the kinds of different places that you might go. So example, Binfield Road at the top of the adult list is a GP practice, and you can see there's a range there of different opportunities. So we work with NHS providers, also some of the independent sector and some of the third sector voluntary services as well. What will it look like? So this is the programme structure starting in 2018. You can see that for the degree programme, it runs over the 3 years. There are a number of modules that are generic. In other words, they're taken by all 3 fields, and then there are some that are field specific. So knowledge and skills, for example, will focus on child, adult or mental health, depending on what you're doing. And for this programme, the elective is in the 2nd year. The postgraduate diploma runs over 2 years. I've already alluded to the fact that there's no option, there is an elective. You also need to have some healthcare experience or health or social care, because we're looking for it to be a shortened programme. What you can do if you do the postgraduate diploma is upon completion of that you can study part-time to do the dissertation to get your master's. The college regulations currently allow you 6 years to complete a master's, so you could do your training, get your qualification, work as a staff nurse and then say, okay, I'll come back. I don't expect for 1 minute that you can see this, but what you need to know, which we think is helpful, is that the yellow is the clinical practice and the lighter lilac is the college time. So essentially the programme is split between theory and practice, so you're doing one or the other. There will be work to do while you're in clinical practice, learning around those areas and taking things forward. But as you can see, students go into practice quite early on in the first term, so there's a lot of skills teaching at the beginning to prepare you for that. And a similar structure for the postgraduate diploma. What I would say is this is the curriculum that we're working to at the moment. We're also developing the curriculum to work for the 2018 standards. So you may be aware that the Nursing and Midwifery Council in May issued its new standards for pre-registration nursing. So we're looking at that at the moment. And our ambition is that we will be running the 2018 curriculum ready in September 2019. We've talked about why coming to King's. Wherever you study, you're going to be using the most up-to-date literature and looking at the research and so on and so forth. And these are some of the examples of the texts that you might be using or some of the research that you might have come across. So I don't know if you can see there, but the Art and Science of Mental Health Nursing is a really key text across mental health pre-registration programmes. It is Norman and Ryrie. So Ian Norman, who's our head of faculty, is one of the editors. Interestingly, Ian Ryrie at the moment is working in the faculty as a publications coach, and he's doing some work with some students who are looking to publish work that they did for their evidence-based practice module. And Dr. Ed Purcell, his research very much underpinned the NICE fever guidelines for children, so very much involved in that. So you'll come across this wherever you study nursing and midwifery, but as they say, out of the horse's mouth here at King's. And then you'll put in your UCAS application, you'll come here, you'll work really hard for 2 or 3 years, you'll make some great friends, have some fantastic experiences, and then you'll be at the Barbican.
In that seat.
As Ed says, you won't all be in the same seat, but that's where you'll be at the end of your programme, ready to go on and become a registered nurse and take on the world. So, we've given you a bit of an overview. I hope that you found it helpful. Do talk to the central admissions, speak to accommodation, ask as many questions as you want. Thank you very much.
Thank you.